To this today's seminar on the crisis in Sudan. My name is Malin and I'm working for FUF. It's an association working with development issues, and we are super happy to be here today at the Swedish Red Cross office. And we have Gisela Holmén here on site, and we also have Natalie Groom online with us. Can you hear us? Yes, she's with us, perfect. And we welcome you all. We also have a live stream going on. And we first gonna be hearing Gisela talking about the crisis, and she's gonna give us an introduction. And then we're going over to Natalie Groom, and she's gonna be speaking about more personal reflections and deeper insights on the crisis. And we also will have time for a Q&A session afterwards. So we have about 10 minutes for the question session, and I'm gonna help you facilitate that. And Gisela, you are the head of the African unit, and Natalie, she's with us from Kenya, but she is the representative from the Swedish Red Cross working on Sudan, and she's very experienced over decades been working on Sudan. So we are super grateful for being here with you today. And with that said, please give them a very, very warm welcome.
Thank you. Great, thank you. Should you say something on the security?
Yeah.
Yes.
And also, in case if the fire alarm goes off, we please want you to just take the exits to the left or the right and go downstairs, and we will gather on the other side of the streets where we're all entranced. Perfect. Thank you.
Thank you. So from Swedish Red Cross side, I'm very happy to be organizing this together with FUF, the development forum, the Swedish Development Forum, to talk about this important topic. And I'm very, very happy to welcome you in this room, but also all the people online. So it's really nice to have you here and your engagement on these important issues. So I am Gisela, as you heard, so head of Africa unit at the Swedish Red Cross. And we have Natalie Groom here, the country representative for Sudan, calling in from Nairobi. So we really hope that the technique will work the whole time. Fingers crossed for that. So I have been working with crisis in Africa for the Red Cross for around 15 years. And for you that might not be so acquainted with the Red Cross, I can just share very briefly that the Red Cross and Red Crescent movement makes up of 3 parts. So we have the International Committee of the Red Cross, the ICRC, that is an organization with a very particular specific mandate in the Geneva Conventions in war and conflict situations to monitor and follow up with parties to conflicts and war on their adherence of the international humanitarian law, or the rules of war that we often talk about, which means not attacking certain groups of people such as civilians, health workers, hospitals, humanitarian workers, and also non-combatants in the shape of maybe injured soldiers or prisoners of wars, etc. Then we have the second part of the Red Cross, Red Crescent movement, and that is the national societies, and that is like Swedish Red Cross, Norwegian Red Cross, Sudanese Red Crescent, Kenya Red Cross, etc. So national societies that we have in 191 countries across the world. in a huge humanitarian network. We have a role in our specific countries, like Swedish Red Cross. If there is a crisis in Sweden, we would have a role to help the state respond to that crisis. Even if we are independent, we would work in a complementary way and have a predefined role, and that is also the same in other countries. Then we have the third part, and that is what we call International Federation of the Red Cross and Red Crescent National Societies, and that is the membership of all of the national societies that come together. We cooperate, we help each other in disasters, we develop strategies, tools and policies together, so to really help each other respond to crises that are maybe beyond a country's capacity. So we at the Red Cross, we are deeply concerned over what we see going on in the past recent years and the involvement of many protracted crises in the world. We have an unprecedented level of people affected by war, conflict and also complex crises. We have unprecedented levels of humanitarian needs and people in need of protection that we haven't seen before, and we also have a trend of situations of repeating violations of international humanitarian law, the rules of war, of parties to conflicts all over the world, which is deeply concerning. And while at the same time we see decreasing engagement and interest of donors in some of the very large-scale crises that we see in the world, and also a disengagement of donors in the humanitarian systems that we have been working in for decades and decades, which resulting in the partial or to a large extent dismantling of a humanitarian response system or aid system that has been functioning for a very long time. And at the same time we don't really see that alternatives are presented in the way that we might want to see, which put vulnerable populations in fragile states, often very, very much affected. We also see, we are all following, of course, very closely also what is going on in the news today. We see what is happening in Iran, and with the US and the tense situation, the conflicts erupting or worsening in the Middle East, the Gaza situation. We see the Ukraine more closely to us, where these situations are of course creating desperate needs and horrific situations, and also a global situation that has dramatically changed over just a few years, creating a dynamic and power shifts that we couldn't really foresee. But at the same time we hear and see less of what is happening in crisis in Africa. We see a lower media attention. We see the situation in Sudan, for example, that we don't hear so much about it in the media on what is going on there. And of course, it is overshadowed of the crisis I mentioned for good reasons, but we really also see that very few people are aware that Sudan is actually the worst crisis that we have in the world ongoing right now, in terms of people affected by the conflict that is going on and also displaced. And I think 2 weeks ago we reached, 2 or 3 weeks ago, we reached the third year mark of this crisis in Sudan. We are now in the fourth year of what is happening there, and we thought therefore that it was really, really important to highlight that non-stop violence that we have seen going on, and where people have fled times over again, where the whole region is affected by the situation, and it's spilling also over to other countries like South Sudan, where we are now in the highest situation of conflictuality, you can say, since the peace accord there 2018, and fighting is ongoing there already, but we are really worried that we are seeing a new internal conflict and civil war in South Sudan due to the spillover and the growing tension in the region. And we also see a worsening situation in Horn of Africa. At the same time, we of course also have other complex needs with food insecurity situations since a decade that has gone worse every year with leaving high proportions of populations in catastrophic level of food insecurity. For example, South Sudan that I mentioned, there we have more than half of the population in an acute food insecurity phase. And in Somalia, we also see catastrophic level, famine level of that, while at the same time with this donor decrease that has affected Africa disproportionately, we see a 70% decrease of donor engagement since last year, for example. So we had a report done from the ICRC, the Committee of the Red Cross that I mentioned before, from last year, that conclude that over the past 5 years we have now a 45% increase of conflicts in Africa, with 50 ongoing conflicts among these 54 countries. Some countries are not affected, but some countries have more than one conflict ongoing. And this is not the fire alarm, by the way. This is another alarm. Which of course put and this has caused then that we have approximate level of 204 million people in contested areas in Africa, where there are conflict ongoing or disputes, which is an unimaginable number, high number of people that flee for their lives, that risk violence in different forms, armed violence, sexual violence, and also other types of abuses, and also where the health care is totally broken down or not available or very hard to access. And also, of course, their opportunities for providing for themselves with livelihood is totally disrupted and very difficult for them to recover. And in DRC, for example, we have 30 years of conflict that has been ongoing, where we since 2 years have seen M23, a rebel group, taking over Goma and other key cities and areas, which also are putting the population in very, very difficult situations. So we see these very clear worrying trends, and then of course with the USAID that from one day to another last year were cancelling a high percentage of their aid program, really shocking the aid system, where US have been holding up 45% of the global aid, and when they pull out, that is of course felt. And in Africa, they were also focusing a lot of their support, and we saw from one day to another many health programs closed down, also mother and child, programs on gender equality and so on, that were completely closed from very short time. And this is also another concern that we see when other donors have followed, and the kind of aid shock that we have seen since last year has been different, since it has been kind of synchronized and donor-driven cuts in very rapid time with very little handover or transition phases for countries to be able to pick up on that, and with some very fragile and vulnerable and countries where with very high levels of poverty, of course this has hit really hard. And many actors, there are many different actors and many organizations, and you are also belonging to some of them, and many have spoken about taking from, cutting down from hungry to give to starving, and starvation management. This is how some organizations, local organizations, have talked about how they have had to deal with it from one day to another. And we see millions of people that are now left without the support or aid that they might need. So indeed very concerning situation, and a lot of things for the both different stakeholders to come together and find ways to address this situation together, because what is needed is, of course, a response, life-saving response, but also a sustainable way to find ways to help these vulnerable communities and states. With this, I think I stop here and will invite Natalie to give some more details around the Sudan crisis. Over to you, Natalie. Thank you.
Okay, thank you, Gisela. I think Helena might share her screen. I'm hotspotting, so I'm struggling sharing screens today. Okay, so my name is Natalie, and I've been working with the Swedish Red Cross now for 6 years. But I think, as Gisela indicated earlier, I've been working in Sudan for many more years than that, working with different organizations, with UNDP and also some different INGOs as well. But since 2020, I've been the country representative for Sudan, and was based in Sudan until the conflict started in mid-2023. So, okay, so let me start then. So Sudan, maybe I'm sure many of you already know a lot about Sudan, and if you don't, or can we just go back one slide? Sorry. Sudan now in April entered its 4th year of conflict. I was actually in Sudan when the conflict started. It had been my home for more than 20 years. And I still remember that time when the first explosion happened in Khartoum on the 15th of April. It was early morning, and I remember checking social media and WhatsApp, trying to find out what was happening, and wondering really whether or not to wake the rest of my family, predominantly teenage children who obviously slept through everything. We were kind of used to shootings and tear gas and violent demonstrations, but we really felt like at that time, I felt it was a bit different, and sure enough, it was. So if I just give a very short overview of the background to the conflict, I would say like the build up to this most recent conflict was in 2019. The then President Bashir, he was ousted after nearly 30 years of power. A joint civilian and military government was formed, but then again in 2021 it was overthrown by another military coup. This coup was staged by figures in the Sudan Armed Forces and also the paramilitary, the Rapid Support Forces, or the RSF. And these are now who are in the centre of the current conflict. And then on the 15th of April 2023, that's when the conflict really started between these two forces, the Sudan Armed Forces and the Rapid Support Forces. And it started in the capital, so it had a huge impact on a large population of Sudan very quickly. And it then rapidly spread to other areas of the country as well. The current situation is that, again, very briefly, is that it's basically roughly divided. The country is roughly divided into two. To the centre and the east, the Sudan Armed Forces are kind of in control, and to the west, the RSF, the Rapid Support Forces, are in control there. But basically, there's ongoing conflict, sort of slash military activities in nearly all areas of the country. So everyone is being impacted. Okay, next slide. So I think, as Gisela mentioned, the humanitarian needs are unprecedented in Sudan. I know this is one of many conflicts globally, but still the population of Sudan is around, well, it was around 46 million, and currently about 33.7 million people, so that's nearly, well, actually over half of the population require urgent food, health, water and protection and education support. These civilians, they continue to face the consequences of violence and repeated displacement. And when I say repeated displacement, some families have been displaced 4 or 5 times. Families get separated, there's disruption of essential services and protection risks. It's unknown really how many people have been directly killed, but it's estimated that it's more than 150,000, and we know that this number is likely to be much higher. I think maybe some of you probably saw on the news last year in the end of October, November time, when the siege of El Fasher, and many people at that time were killed, but we still don't know the exact numbers. Next slide. So displacement, it's massive. So roughly 12 million civilians have been displaced, either internally or across borders, to countries including Chad, Egypt, South Sudan, Ethiopia, CAR, Libya and Uganda. And of course millions, it's just under 9 million now remain displaced in Sudan, and the conditions they are living in, or many of them are living in, are terrible. I said earlier that I've been living in Sudan for many years, and one of these reasons is because my husband is Sudanese. So many of my husband's family have been displaced. I mean, as to, I guess, have us. But we visited in beginning of this year, we visited Egypt to go and see many of his relatives. And really what I observed, and I think when we think about people being displaced, we see sort of camps, we see people, living in really dire conditions, but it's also the mental toll on people as well. And what I saw when I went to Egypt and we were visiting many relatives was that everyone is living in limbo. They don't know what the next day will bring to them. the elderly and the young, they are relying on a few people in their household who may be bringing in money. They may have one person still in Sudan who is supporting them financially, and but money can only go so far. When you are supporting many members of your family and elderly neighbors, friends who might call you and tell you that something terrible has happened to their family, or it's really challenging, I think, on people's mental health. And it's something that in the past wasn't really discussed much in Sudan, but I think slowly people are beginning to discuss it more, which I think is really positive. But of course it's not a positive situation that has brought this about. So many families are separated by violence, and not just separated, many people go missing. ICRC so far have received requests for 11,000 missing people, and of those they've only managed to locate 850 people. So also just that toll on people of not knowing where your loved ones are. People are beginning to return. The context in Sudan is very fluid, and so we are seeing that people are returning. So far it's around 4 million people have returned to their homes, and this is often because of the perception of improved security. However, it's also because people are driven to go back because they have had prolonged displacement, they have worsening economic conditions, and there's little or no humanitarian assistance. So in the end they decide it's better to go back to where they live, to their homes. However, often when they return back to their homes, they're finding their neighborhoods where homes and water systems, health facilities have been really badly damaged, and just generally it's just very difficult. So you come back to your home, but it's not like it used to be, and it's difficult to live. So often you find families are living in sort of partially collapsed houses or shelters with minimal access to basic services. And I mean, I guess what I find so frustrating and upsetting is that so much of this humanitarian impact of the war in Sudan could have been avoided if international humanitarian law had been respected. Okay, next slide, please. Yeah, so as I mentioned, people are returning to their neighborhoods, and they are finding that hospitals have been damaged, electricity is no longer there. So over the last 3 years, a lot of sort of health facilities, electricity, sort of basic services have been targeted. As I say here, WHO, so the World Health Organization, has verified, this was until last month, 217 attacks on healthcare facilities, of which more than 2,000 people died and 810 people were injured. And that's just on health facilities. One example of that is in East Darfur, just last month. There was an attack on a teaching hospital, and 64 people were killed, including children and health workers, and the hospital now is no longer functional. And that hospital served as a critical referral hospital for many hundreds of thousands of people across East Darfur. In many areas where there is conflict, estimates of 70 to 80% of healthcare facilities are either non-functional or barely operational, or they don't have the staff to be able to provide the services they need to give, or they're not able to receive medicines because access is really difficult. Say over 20 million people require urgent healthcare. Food. I mean, again, here we're looking at nearly half the population who are acutely food insecure. This means they're not eating regular meals. It may mean they're eating once a day, or the adults are going hungry, the children are eating. And even what they are often eating, it has very little nutritional value. So it's having an impact on the health of people, and one reason because of this is it's not, in some places food is there, but the cost of it, the rising prices, means that people can't afford to buy that food. And humanitarian aid is, it is there, and they have tried, but it's underfunded. Access is very, very difficult, and it's just like a drop in the ocean when you actually reach people. So now there's over 4 million people are estimated to be acutely malnourished during 2026. So I think this is like nearly 40% of Sweden's population. So if you just try to visualize that, I mean, imagine 40% of the people are malnourished, and of course that has particular impact on children and pregnant and lactating women. Okay, the next slide, please. So this is a school that we support as Swedish Red Cross in northern states. So we have for the last few years had a relatively small program just targeting 24 schools, but the sort of things that we are working with the children on is particularly psychosocial support and psychosocial first aid, as well as looking at disaster risk reduction as well. So, but a big focus is on clubs and trying to have routine in children's lives. However, there's around 17 million school-aged children in Sudan, but nearly 13 million of them are out of school. It's not that they want to be out of school, and approximately 7 million of those 13 million are registered to go to school. It's just that they are unable to go to school because of conflict or displacement. There's about 6 million school-aged children who are not enrolled. Before this conflict started, there was just under 3 million out-of-school children, as we would call them. So also, even, as I say, access to schools. So at the moment, around 50% of schools remain closed. That's particularly in areas where there is active conflict. So in Darfur, in the Kordofans. In the east, schools are beginning to establish more, but still the schools are overcrowded because there's many internally displaced people. And we find that the schools are having to work in shifts because they're overcrowded, they're hot. So when I talk about shifts, literally you have one group of kids who go in the morning, one group of children who go in the afternoon, or in some places children will go for 3 days and then another group of children will go for 3 days. Of course, this also has impact on the teachers, and many of the teachers have not been paid since the beginning of the war. So what does this mean? This also means that children are not getting an education. They haven't been getting an education for more than 3 years now. Many of the older children who were due to take exams were not able to take exams. My children in some ways were lucky. We were able to move to a place where they now go to school, but my eldest didn't take her school leaving exams. And she was now what I consider to be a lucky one. But the majority of children have not now had that opportunity to be able to go back to school, to take exams, able to finish university degrees. Universities have had some online, but of course not all internally displaced people, not everyone has access to computers. So again, it's a very small number of students that have been able to continue their university courses. Okay, next slide, please. Okay, so sexual violence has surged since April 2023, affecting women, girls, men and children. There's many reported cases of rape, of sexual captivity and other gender-based violence. I was trying to sort of read a little bit more about this, and I came across a statement from the UN Women Regional Director for Eastern Southern Africa. And she said, women and girls are being raped and killed in their homes, and as they flee, seek food, water and medical care. The use of sexual violence has been embedded in the blueprint of Sudan's war. It's horrifying, and it's happening now as we speak. This is continuing to happen. MSF, so Médecins Sans Frontières, when the Rapid Support Forces captured El Fasher in North Darfur last October-November time, they treated more than 140 victims and survivors, and then within the first few days of rape and sexual abuse, they then treated in the next month a further 732 victims and survivors. So huge numbers. Okay, next slide please. And whilst all this is going on, I can't not speak about the Sudanese Red Crescent who we work with. They've continued to work throughout Sudan. They have 122,000 active volunteers in 18 states. They have more volunteers than that, but at the moment the active ones are 122,000. I think the important thing is that they're members of the communities that they assist, so they are really uniquely positioned to assist when there is a crisis. But the conflict has also really affected them because, they are both responders, but they're also crisis affected. So they're also coping with displacement, with personal loss and concern for their families. They're regularly exposed to traumatic events, and the workload I've seen for myself, it's never ending, it's overwhelming and exhausting, and I think we have to really appreciate the work of people like those that work for Sudanese Red Crescent, the staff and the volunteers, and also other frontline responders in Sudan. Very, very sadly, the Sudanese Red Crescent have lost 22 staff and volunteers whilst they have been on active duty. And unfortunately, in Sudan, even though we are trying to fundraise, we're really, really lacking funding, and it's felt every day, and competing priorities and limited funding basically means that we are not able to support the people in Sudan, the Sudanese Red Crescent, in responding sufficiently to the most vulnerable people. Next slide, please. So this is a photo of a family that are staying in accommodation. It's a small family. It's pregnant mum and dad and their 5-year-old daughter, and they're staying in an accommodation centre in Port Sudan, which is in the northeastern area of Sudan, which has not had active conflict, so many people fled to Port Sudan. It was a larger family. They sadly lost 4 of their children. They fled their home in Khartoum and now are living in school classrooms with other families. You can see from the photo here, this is their home, this is their space. They're relying on support from organisations for food and everyday items. I think for me, we often talk about the resilience of Sudanese people, and I think this goes for any country that is in conflict, but yes, people are resilient, they are resourceful, they're kind, they're generous, and they support one another, as we've seen all over Sudan, where many communities have welcomed and hosted displaced people. But the problem is that they don't have a choice but to be resilient. So that to me is not acceptable. The fact that they have to keep going, they have to be resilient. And yes, I think we should applaud them for that, but the fact that they don't have a choice to me is wrong. Okay, thank you. That's all. Thank you. I'll leave it there.
Perfect. Thank you so much, both of you. I gained a lot of new insights from this presentation and from you, Gisela. And I hope you also bring something with you today. And now, if you have some questions, please raise your hand and I will go around and make turns. And otherwise, I can start with one of my questions for you. Previously, before this seminar, we had another seminar with Adebayo. He's a professor from South Africa, and he was talking also about the aid cuts all around the world. And he was saying one thing that he was hopeful about, and that was that he could see African countries going together and working more and cooperating more together. And I was thinking about if you have also experienced some of these trends, and also for you, Natalie, if you now staying in Kenya, if you have seen Kenya and Sudan working more together, and how this is taking shape in Africa. Yeah.
Thank you. Really good question. I think that we see some of these signs, and I see it, for example, in the sector where we work. So maybe in some countries, we also can see it. But from my own experience, I think that the fact that we talk with each other, we try to find innovative ways to work together as organizations and raise the concerns and issues together is a very positive thing for me that I see. We lack a lot of resources, and we all try to optimize what we have and try to work together in a different way. And also see private sector coming in the picture, which is we are developing innovative ways of working more around that. We have, for example, Solvatten here today that we work with Swedish Red Cross. We work together in Mozambique, for example. So I was very happy to see you there, and it's also like positive examples that sometimes unexpected new actors come in, or one is looking at that aspect, and then of course what I also want to emphasize is that we really see, like when Sudan crisis were unfolding, we saw our colleagues, the Sudanese Red Crescent, we saw the communities. I think Natalie can speak better than I about that, but we really saw how they stepped up. This is such a terrible situation to respond to, and when you flee, you have to flee yourself, and yet they went out every day in the response teams and saved lives and evacuated people. They really stepped up and have been providing us as Red Cross colleagues as an example of the bravery, how do you implement these principles every day. So I think they have really stepped up to the situation, and we are really humble to see that as their colleagues and partners. Natalie, over to you. Have you any comments on
I have maybe just a couple of practical examples of how different national societies, Red Cross, Red Crescent societies have worked together. So the Kenya Red Cross and the Sudanese Red Crescent, I mean, they're quite close to one another, but before the conflict, I would say there was very minimal interaction. But what I have seen over the last few years is that Kenya Red Cross, for example, has supported Sudanese Red Crescent with doctors to work on medical projects, which and for them that's Kenya Red Cross provided the financial support to be able to do that. and they're trying to do that more and more. So having more regional approach to support. We've also been like peer-to-peer mentoring. So I would say often in the past we do things like we send people on trainings, and they're not always, particularly if it's in a different context. But this time again, we've had people exchanging, coming from Sudan to Kenya, to be able to learn about how to do logistics, to learn about HR and things like that. So there's been a lot of peer-to-peer, and also they've been able to give, I would say, the Sudanese Red Crescent in an earlier part of the conflict, like a safe space, a space where they could come and hold meetings, and that was also done with goodwill as well. So just a few practical things that they have been doing. Thank you.
Perfect, thank you so much. Yeah, what's your name?
Yeah, thank you so much. My name is Cynthia, and I am from LM International. And thank you, Gisela and Natalie, for such great presentations. I have just two questions. The first one was around a very critical point mentioned, particularly when Natalie was speaking about the RSF being in control of Western Sudan, and of course the center and east run by Sudanese forces. It was more around access. I'm sure also you must have been familiar with the IPC records about certain areas plunged into famine, even at areas of IPC 5 classification. But then the problem about also reaching vulnerable populations, because some of them are rebel controlled, and then also the challenges around access. How has the Swedish Red Cross and even the Red Crescent movements been supporting that? The second question was around protection. I am glad that Natalie raised a very critical point about the sexual violence and trauma being experienced, in fact, used as a weapon of war in Sudan. But then also with the funding cuts, there has been great challenges in terms of protection-centered services being stopped and halted and even impeded. But it might be good to also hear how the Red Cross and the Red Crescent movement is navigating this. Thank you.
Thank you. Great questions. Natalie, do you want to start?
Yeah, okay. Yeah, great questions. Difficult questions, actually. When it comes to access, actually, I mean, the access has been difficult in all parts of Sudan. Whether, even if you're not having to cross front lines, even because of bureaucratic impediments, but also because of the safety and security of our colleagues. So, how we have worked, or how the Sudanese Red Crescent have worked a lot with, if I just look at provision of food, they work very closely with WFP. So what we've found is if WFP can get it to a certain point, because the Sudanese Red Crescent have volunteers, community volunteers, and also staff in the capitals in all 18 states, but also community volunteers in many of the communities, they are then able to assist then in the moving of those the food items, or I mean, ideally WFP try to bring it right up to where the communities where you want to deliver. But there's also been times as well where they have then been able to move it because they haven't had to move very far, which again is putting the staff and volunteers at less risk. Because as you know, like some of the convoys, the aid convoys have been attacked, and so one of the greatest concerns really is the security of the safety of the frontline workers, and in our case the Sudanese Red Crescent volunteers. So it has been really difficult, but I think because we have a presence, and again when I say we, I talk about the Sudanese Red Crescent, because they have a presence everywhere, it has made it a little bit easier. Of course there's still massive challenges, so I can't say that it's perfect, but they have been able to reach some areas where maybe other organizations have not been able to reach because they're already there in that area. When it comes to protection centered services, so generally we support health projects within Sudan. For at the moment, we are supporting in White Nile State, where there's a lot of refugees and IDPs, and then we also support in Northern State, where there's many IDPs. And so, as part of the health programs, we integrate awareness around sexual-based violence. We do a lot of training for volunteers, and we also look at the pathways, the referral pathways as well. But of course, the challenge always is when it comes to referral pathways is that the services are not always there. We try to work with others, with other organisations, with the authorities to try to support this, but it is really, really difficult. And I think it's made even harder as well because of the stigma. So one of the things that we do a lot of is awareness raising, and actually just this week in White Nile there's been a lot of awareness raising going on in certain communities through one of the projects that we are supporting. But again, it's not easy, but for the Sudanese Red Crescent, any health project that's being supported, it'll be an integral part of it. So as part of the sort of package as it is. Yeah, thank you.
Yeah, no, and I can also add to that also the International Committee of the Red Cross are also engaging with all parties and around IHL dialogue, and of course all Red Cross, all partners to the Sudanese Red Crescent, and also the movement, Red Cross Red Crescent movement, are really trying to integrate the protection in different types of programs, but a lot of directing to taking care of displacement, helping tracing missing families, and maintaining contact with family members, and trying to also work with survivors of sexual violence and try to do protection on that. So many different ways, but advocacy is also for the conference on Sudan. We also handed in a document to on the points, the key messages from the Red Cross on IHL, and how states can also engage and push for political solutions, and also emphasize the need for access for humanitarian actors and the protection that is needed. So very important points. Thank you for that. Great.
Perfect. Thank you so much for the question. Next one here.
Can you hear me?
Yes.
Thank you for a very nice presentation. I have one question. I think you guys mentioned something about the instability in the Horn of Africa, and I was just wondering if there's how the instability in the Horn of Africa affects Sudan, and also how the case of Sudan and what's going on can be seen through the lens of a larger theme going on in the Horn of Africa. If you understand my question.
I think so. Thank you. Great question. No, we definitely have seen how the crisis in Sudan has contributed to decreased stability, and we see, for example, as I mentioned, the South Sudan situation, where we also see increased violence in Ethiopia, for example, and we see population flee over borders from South Sudan, for example, to Ethiopia as a result of increasing tensions and population movements that also occurred from Sudan, and people returning from Sudan back to, for example, South Sudan, and crossing borders to other areas. So there's definitely a link of the dynamics and tensions. We also see, border crossings, people fleeing to Chad, and that also actors are trying to respond to the needs there, and also over to Egypt, for example. In the beginning of the crisis, there were also a lot of crossings that happened on that route. But now the concern that we have, for example, is that the spillover effects might worsening the situation for Ethiopia and Eritrea tension. So that's something. We see the eruption of armed violence in Ethiopia, for example, and that's a great concern that we have, that it will deteriorate again. It's very fragile situation there. Anything else from you to add, Natalie?
No, I think you've covered it quite nicely. Thanks.
Yeah, thank you. Other questions?
I think we might have time for one more. So if no one else wants to ask, I can take one.
And we have
Here we yeah.
Hello. No, just more maybe on the current affairs and what needs to be politically be happening for it to reach peace. I mean, just to understand a bit, as you mentioned earlier, it's we're a bit of a shadow of the current affairs. So it would be interesting, are there peace talks going on? What is being done on the high level? It would be interesting to understand more.
Great. I will comment a bit and then hand over potentially to Natalie. So from our side, of course, we need a cease of hostilities. We see that the ongoing fighting and lack of access and lack of any type of ceasefires is really not helping in these situations. And also all the breaches of the international humanitarian law, the violence on the civilians really needs to stop as immediate measures. Then, of course, we need to see some kind of peace accord and a plan to kind of create the stability and the environment where parties can find a solution. There is currently not enough talks going on between the parties, and also there are other actors engaging, of course, that keeps the fighting going. So the political pressure needs to be from other governments to the parties that are engaged in this to cease fire and start maybe establishing the safe passage to the areas where we don't have access, and then start from there. We also see a country that has been completely destroyed. Infrastructure, health infrastructure, the damages that is caused to the society. There is immense need for recovery work and reconstruction work and rebuilding of a country that has been torn to pieces, actually. Natalie, maybe you want to add something to that? It's a huge question. Thank you. Very good.
Yeah, I think you sort of touched on a few things, Gisela, but I mean, earlier on in the conflict there were some attempts at some peace talks, and there was this so-called Jeddah agreement, but unfortunately it has not really helped much, to be quite honest. As Gisela said, there are so many actors now involved. There are so many that have so many needs, so many, they have so many, I don't really know how to put it. They have they have their own wants from this type of conflict. So it's very, very hard. So I think we need more advocacy from countries that are not involved. I think So a lot of countries are involved in different ways, maybe some more publicly, some less publicly, but I think, as Gisela said, I think we need to do a lot more advocacy to be able to put pressure on those actors that are now involved in the country and in this conflict, and try to stop the flow of resources that is kind of enabling the conflict as well to continue. So, yeah, thank you.
Thank you.
Okay, unfortunately we have to wrap it up here, but we thank you so much for the opportunity to host this event together, and hopefully we will do more in the future. And for everyone attending today and on the live stream, a warm applause for everyone. And time for mingle.
And I can also just say that if you have questions that you pop up after, you're welcome to contact us. We really, like that. So please don't hesitate to reach out to us. And I also want to take the opportunity to say thank you for you to come here. This is one of the things that really brings hope for, in the world. We talked a little bit before on, what are the positive things, and I think the engagement that you bring into this and that you can bring forth, in the work, and where our joint effort from wherever we are to bring light and attention to these situations and crises is really helping, and also something that we deeply see needed in these times of uncertainty. So thanks a lot for coming. Really appreciate it. Lovely to see you, and hope to see you soon again. Thank you. Thank you, Natalie.